Hello everyone, my name is Yvette Trista and I am a student from the Master of Science in Occupational Therapy at Kaiser University Fort Lauderdale campus. Today I'm going to be going over a chapter from my class textbook, Occupational Therapy in Mental Health, a Vision for Participation. The chapter that I choose to explain is chapter 19, which is called Psychosocial Concerns with Physical Disabilities. One thing that I would like to point out about this chapter is the description of the condition. The term acquired physical disability comprises a wide range of disabilities that can result from trauma or disease, including but not limited to spinal cord injuries, traumatic brain injuries, stroke, and significant musculoskeletal injuries such as limb amputations, multiple trauma, and burn injuries. So another thing that I would like to point out is the psychological implications of physical disability. The initial reactions to an acquired physical disability typically are characterized by a range of conflicting emotions: shock, disbelief, anxiety, fear, anger, of conflicting emotions. Also, common emotional reactions to physical disability include sadness and crying, despair, guilt, fear of losing control, disbelief, panic, helplessness and inadequacy, denial, confusion, anger and resentment, loss of interest, apathy, loneliness, and withdrawal. Managing daily life with physical problems such as paralysis, spasticity, incoordination, loss of sensation, speech disturbances, vision loss, and pain is an ongoing and demanding process requiring new learning, reacquisition, repetition, and practice of skills. Researchers have rejected a linear or stage-specific model to explain the emotional responses to disability. Instead, they recognize that responses evolve throughout time relative to the onset of disability as well as across the lifespan of different developmental stages and challenges are encountered. Individuals face trauma not just in the form of the injury or illness itself, but multiple traumas or losses as a consequence of the condition. Issues such as those in the following list present psychological and emotional challenges to be negotiated. For example, loss of control of basic physical functions, inability to participate in activities that give a sense of pleasure or achievement, changes in relationships with family, friends, and/or sexual partners, disruption of cherished roles, radically altered body image, loss of self-esteem, diminished sense of meaning or purpose in life. In this chapter, they go over each one of the examples that I provide before with a more explained and argumented portion. Now, for the psychiatric conditions associated with physical disability, we can find depression and anxiety, post-traumatic stress disorder, substance abuse, and suicide ideation. The effects of physical disability on the family. Occupational therapy practitioners need to recognize that the effect of an acquired disability presents numerous challenges not only to patients but to the entire family systems, as family roles and relationships are drastically altered. Also, on this chapter, we can find the impact of occupational performance. A key theoretical concept in occupational therapy is that we are what we do. That is, the daily occupations we choose to engage in, say something about who we are and how we see ourselves. The role changes, the past, present, and future self are also brought out in these chapters. Factors related to positive adaptations are also explained. Coping strategies, locus of control, social support, gaining knowledge and communication. resilience, and also interventions. For this chapter, I would like to also add that they have a table 19.1 interventions, so psychosocial concerns with physical disability. Thank you for your time and for your attendance.